Hello everyone, Claire here again from Yoga Tums. I thought that I'd do another vlog this week on Caesarean sections. So obviously Caesarean sections are not something that everybody really particularly plans for unless it is an elective C-section for whatever reason. It could have been particularly traumatic birth first time or a medical reason. I'm gonna spend some time this morning just kind of going through everything in terms of a C-section. I had two C-sections. I had an emergency C-section first time round, and I had a elective section the second time round. Both experiences incredibly different. Obviously with an emergency there's a lot going on. There tends to be a lot of noise, people talking to each other in medical jargon, and you're not entirely sure what's going on, and it tends to be a very different situation. I remember feeling quite like worried, like what is going on, but the medical team were quite good in the way they were like, look, this is happening, we need to do this, this is why we think that you need to go down to theatre, and that was that really. But elective sections are very different, but I'll talk about that in a little while. Okay, so what is a C-section? So a cut is basically made across your tummy, all right? So it is a major operation, there's no two ways about it. I basically had a scar that was placed underneath the belly, and it's around about, I would say, probably about, how many centimetres? Probably about 15 centimetres across, and it was actually not quite as painful as what I thought it was going to be. I'd made it all in my head thinking, oh goodness me, if it's going to be like this, I'm going to be out for the count for ages, I'm going to be, not going to be able to function. But it's surprising how much you can actually get done. So it's a cut that goes just underneath there. Okay, so I'm going to explain a little bit about what kind of happens during a C-section. So it's carried out under a spinal or epidural. So that essentially means that you're going to be awake, all right? So the lower part of the body is numbed, and the whole operation from start to finish is usually around about 40 or 50 minutes. Occasionally a general anaesthetic could be needed, okay? Particularly if the baby needs to be delivered a lot quicker than what it would be, in a normal situation. So if that's the case, and it is a general anaesthetic that's needed, obviously you are going to be awake and your partner will be asked to leave the theatre. Okay, so what will happen is you'll lie down on the operating table and with a very slight tilt on the bed, and then a screen is placed across your tummy, and then a cut will be made. Okay, now they will be checking you before any incisions are made. They will be checking you to see if you have any kind of sensation whatsoever in the legs. Okay, so you were having like a freeze spray put all the way down your legs, and they'll be saying to you, can you feel this, can you feel that? And once they are satisfied that you can't feel anything at all in the legs, then they will go ahead and make that incision. So they'll make the cut across the tummy just below your bikini line. On rare occasions they'll make a horizontal cut, but in all fairness, I've never ever come across anybody that's needed to have a horizontal one. Your baby's going to be delivered through that opening, and this is usually going to take anything between, I'd say, 5 and 10 minutes, something like that. And you won't experience pain. I need to make that very clear, that it's not pain that you're going to feel. However, it's a sensation that you feel. more than anything else. So there's a kind of a sensation of pulling and tugging, and a lot of people, as well as myself, described it a little bit like somebody's doing the washing up in your belly. So it's a really weird sensation. And so the baby, as soon as they deliver the baby out, the baby will be lifted up towards you so that you can see your baby. Now that's a very important part for a couple of reasons. First of all, obviously, first things first, you are really excited and can't wait to see your baby, so that's brilliant. So they're going to show your baby, but also your body, your brain needs to see that baby, because only at that point then can the body start to produce the hormones that would help with breast milk production. Okay, so it's important that the baby is shown to you. So your birth partner will be able to see and hold the baby as soon as they have cleaned him or her up, and they'll be sent. Your baby will be sent over to the side of the theatre where they'll be put onto some scales and weighed, cleaned up, and also at the same time the placenta will also be delivered as well. So baby comes out, and then the placenta comes away and is basically placed into a receptacle of some kind. Now I didn't get to see what this receptacle was, but a receptacle, I'll leave it open like that, and your birthing partner will have the opportunity to cut the cord. Okay, so that part is still involving your birth partner, which is so lovely. So once that's been sorted, you're given an injection of the hormone oxytocin, okay, and this is to help encourage your womb contract and to reduce the blood loss. Okay, so obviously when your womb contracts, the placenta's coming away as well, so all of it works together beautifully. The womb is closed with dissolvable stitches or staples. Now I don't know, it depends on the trust that you're with. So if you are with the Nottinghamshire Trust, they may use dissolvable stitches. If you're anywhere else, they may use something completely different. Okay, so from start to finish, from the moment you get into the theatre, from the moment that you leave to go into the recovery room, takes around about 40 to 50 minutes while they stitch you back up and get you cleaned up and sorted. Okay, so what are the reasons why we would need a caesarean section? Well, there's quite a few. The first one, particularly I would say with planned C-sections, is that the baby could potentially be in breech position. All right, so breech position being not head first, so that could be bum first, it could be feet first, and the hospital will generally encourage you to have an elective C-section. The chances are, with some breech babies, they do actually turn. It's not the end of the world if you find out your breech. There is still an opportunity to help yourself turn, but that is one of the reasons. Another reason is the placenta previa, okay, and that is where the placenta is basically covering the cervix completely. It's completely covered, and there would be no way for your baby to be born naturally, because obviously the opening to the cervix is completely covered. You could have a condition like preeclampsia. Okay, so with preeclampsia, it's quite a dangerous condition. So they will be looking to move you into an elective section as soon as possible. There could be certain infections that you have. Baby might not be getting enough oxygen or nutrients. Maybe perhaps the baby's struggling in some way. So they're going to be looking to get baby out. Potentially in terms of, especially in the emergency C-section, the labour might not be progressing the way that everybody thinks is okay. Maybe things are taking a little bit too long. Maybe things have really slowed down because it's a back-to-back labour. for whatever reason, if that labour's not progressing, you know, mum will tend to get exhausted if that labour's going on and on and on. So they may make the suggestion to you that it's time to really consider having a C-section. In terms of an elective C-section, there's quite a few reasons why people would ask for that. You know, obviously there's the medical reasons, which is what the hospital would suggest to you. But some women really do find the whole idea of giving birth naturally petrifying, you know, and particularly if they've gone through a birth before that was horrendous. You can really understand the reasoning why somebody would say, yeah, I really want to do this. I don't want to go through labour, and that's okay. That's okay. And I want to convey this message over to you all, that if that's how you're feeling, or if it ends up being a C-section through emergency, I really, really strongly say to you, please, please, please don't feel in any way that it was a failure on your part, or it's about to be a failure on your part because you've gone down that route, or the birth's taking you down that route, okay? The most important thing a message that I can get across to you is that your baby is born safely and you are well, okay? Those two main important factors go far and above beyond having, you know, we all have nice dreams of how a birth's going to go, but sometimes it doesn't go that way, okay? And I remember when I had my C-section, I remember that there was a lady in the bed next to me, and she was absolutely breaking her heart, sobbing her heart out, because she thought that she'd failed. She thought she'd failed herself, she'd failed her baby, and she'd failed her husband. And that, you know, is crazy. At the end of the day, you have given birth, it has happened, your baby's safe, everybody's well, and that's got to be your focus, okay, above all anything else. Now, moving on to probably one of the most, I would say, the most frequently asked question about C-section, and one thing that mums do worry about, and that is recovery time. You know, at the end of the day, calling a spade, it is a major operation, okay? You are basically having an incision through muscle, nerves, tissue. It is, you know, there's several layers being cut through, okay? And that's going to take some time to recover from. So I would say, in terms of the average stay in hospital, you know, you're not going to be going out that day. It's not going to be happening. At the very least, you're going to be staying in hospital overnight, okay? Depending on how things have gone, how you are, generally, it could go on to 2 nights stay. But if everything is well, I would say usually round about a 1 night stay is perfectly normal. You're going to feel a bit of a discomfort in your tummy, okay? The stitches take a good few weeks to dissolve entirely, if that's, you know, if that's the route that the hospital have gone down. You have to take care of yourself, okay? So the most important thing I'd say is not heavy lifting at all. Anything weighing over the weight of your baby, you should not be lifting it, okay? I would say, yeah, putting the kettle on, fine. Lifting your baby, fine. But be very careful. If you imagine how we bend and pick things up, the first thing that we use is our abdominal muscles, our core muscles, to help us. And what will end up happening is that the muscles in the back will start to take the strain. So just be very mindful of that. So when you go to cough or sneeze, holding on to those stitches when you cough or sneeze is really important, just to protect yourself, okay? So making sure that you don't overdo it. This is when you start to use your voice. You know, you need to ask for help. You need to say to your partner, you know, I really do need help with this. You know, carrying car seats is an absolute no-no. They are very heavy on their own. without a baby in them. You go putting a baby into there and you're picking up the best part of 8-9 kilos, okay? So you need to be very, very careful about lifting anything heavier than your baby, all right? So that's it. In terms of driving, I mean, that's a big one. Being stuck at home with a newborn and not being able to get out is tough, okay? Now, the NHS guidelines say that you need to be avoiding driving and exercise and everything else for 6 weeks while you heal. In terms of the exercise, I fully agree with that. Any kind of vigorous exercise needs to be left, I would say, at least 10 to 12 weeks after you have given birth. In terms of driving, as far as most insurance companies go, and you need to check this with your own insurer, okay? But a majority of insurers will say to you that as long as you can perform an emergency stop, then you are fine to drive, okay? So that's something that you need to check. As long as you can do that, then you are okay to drive. Recently I met up with some of the new mums from Radiance Yoga, and quite a few of them had C-sections, and a lot of them said that after a week or two they actually felt a lot better. And I would say, for myself personally, yeah, I would say around about a week you will start to be moving around a lot more, feeling a lot more confident. Be careful with that, make sure that you're still not overdoing it and that you're not lifting up anything heavy. Other than that, yeah, it takes time, but it's not the end of the world, you know, you'll get over it. So once that you are able to start exercising, then starting to engage these tummy muscles slowly but surely, a postnatal yoga class is absolutely ideal for that, as you start to learn how to move and learn the postures that help to engage the belly. So just be very careful to begin with, and then build up your strength as time goes by. Okay, I hope that has given you everything that you need to know. If you look on the NHS Choices website, you will find lots and lots of information about C-sections, elective and emergency. So obviously refer to that if you need to. If you have any questions, equally, please just post a question to me and I'll endeavour to answer that as soon as I can. All right, my lovelies. Mwah. See you all soon. Bye.